Imagine a world where the mysteries of pediatric epilepsy are being unraveled at an astonishing pace, thanks to groundbreaking advancements in genetics. This is not just a dream. It's a reality that is transforming the way we approach treatment for children suffering from this condition. Dr. Sucheta Joshi, a prominent figure in this field and the medical director of the Comprehensive Epilepsy Center at Children's Hospital Los Angeles, shares her insights on this remarkable evolution in care. Dr. Joshi reflects on her journey in pediatric epilepsy, stating, "I have lived through an era in this field. We went from not knowing why a child has epilepsy to pinpointing genetic causes, and now we are developing gene-based therapies tailored to specific types of epilepsy. This evolution is particularly significant at CHLA, which stands out as the only Level 4 Pediatric Epilepsy Center in a dedicated children's hospital in Los Angeles. Here, a comprehensive range of diagnostic and treatment options allows specialists like Dr. Joshi to customize care for each individual patient. She emphasizes, for certain forms of epilepsy, we can now inform families that a targeted medication is on the horizon, one that will address not just the seizures, but also the underlying genetic cause. The exploration of genetics has led to the identification of over 1,000 genes associated with epilepsy, a number that continues to grow. This surge in genetic knowledge has paved the way for precision medicine, which is why CHLA has established an on-site clinic dedicated to genetic testing. Dr. Joshi elaborates, by understanding the role of specific genes and how they influence brain cell function, we can guide our choice of anti-seizure medications. This knowledge helps us select treatments that are effective for genetically defined epilepsy and avoid those that could exacerbate seizures for patients with certain genetic mutations. A prime example of this is Dravet syndrome, which is linked to mutations in the SCN1A gene. Dr. Joshi explains, some anti-seizure medications can actually worsen seizures in children with this mutation due to their effects on sodium ion channels in the brain. However, there are FDA-approved treatments specifically designed for SCN1A-related disorders. Identifying this mutation through genetic testing allows us to bypass ineffective medications and initiate appropriate treatments much earlier in the child's care journey. Moreover, genetic testing has also facilitated the creation of non-pharmaceutical interventions, such as the medical ketogenic diet. This high-fat, moderate protein, and low-carbohydrate diet can be particularly beneficial for certain genetic forms of epilepsy. For instance, in GLUT1 deficiency syndrome, where patients struggle to transport glucose to the brain, the ketogenic diet provides an alternative energy source. Dr. Joshi notes, by breaking down fats into ketones, the body can supply the brain with the fuel it needs, which can significantly reduce seizure activity. In addition to dietary approaches, advancements in surgical techniques and neuromodulation methods that involve stimulating the brain have also shown promise in controlling or even eliminating seizures. Despite these advancements, challenges remain. Approximately 25% to 30% of individuals with epilepsy experience treatment-resistant forms of the condition. In other cases, while treatments may lessen the frequency of seizures, they do not completely eliminate them. Dr. Joshi stresses the importance of timely access to comprehensive pediatric epilepsy centers for genetic testing, stating, "We still lack uniform access to genetic testing nationwide, which is crucial for providing all children with cutting-edge diagnostic and therapeutic options." At CHLA, the collaboration among medical genetics experts, neurologists, epilepsy specialists, and the Center for Personalized Medicine is exceptional. Dr. Joshi explains, We work together to ensure that each child receives a treatment plan tailored specifically to their needs. As we stand on the brink of a new era in pediatric epilepsy care, one can't help but wonder, are we ready to embrace the full potential of genetic advancements in medicine? What are your thoughts on the role of genetics in treating epilepsy? Join the conversation and share your opinions.